Hi, my name is Dr.Mythri Shankar and I'm going to talk to you about radio-iodine therapy. Your physician has ordered this treatment for you mainly because your thyroid is overworking than it normally should. There are three options to treat this. One is oral medications or surgery, and what he has referred here for internal radiation therapy. Oral medications and surgery come with their own set of complications. It could be side effects or nerve damage or bleeding, so on and so forth. However, iodine therapy is exquisitely precise. The iodine just goes only to the thyroid, sits there for a while and burns the gland over time. Typically, it takes about 6 to 8 weeks to see the effects of this treatment, and depending upon what your initial thyroid scan shows, about 80 to 90% of the patients will need only one treatment. Maybe a small percentage of them would need a second treatment. It's a one-time permanent therapy. It could come either in a form of oral capsule or a solution which would be administered through mouth, and there would be an hour waiting time. Then we do the survey scans, make sure there's no vomiting or anything else like that, and then we would send you home. Once you go after the treatment, on your way home, we would want you to go directly home, not walk around in the hospital trying to collect your reports or the pharmacy, so on and so forth. There are some side effects from this treatment. When it goes to the thyroid gland, it could also go into the lacrimal glands, that's the tear glands, and or the salivary glands, the spit glands, and cause dryness of the eyes or the mouth. So to avoid this, we recommend you to kind of wash it out, if you will, by either chopping onions or crying, watching weepy movies, so on and so forth, or also by chewing lemon drops or sour things, which makes the salivary glands wash out. Typically no side effects, maybe some amount of mild fever or gastritis type of symptoms, nothing something like Tylenol or Dolo couldn't handle. And once the treatment is administered, once you go home, it is like you are radioactive, in the sense, think of it like light is coming from you. So it's very important to protect others from you from this radiation. You need this treatment. However, the people around you should be handled in such a way that the least amount of radiation goes to them. What we follow is called the ALARA principle, ALARA, as low as reasonably achievable principle, and it mainly works on 4 pillars. One is clean, separate toilet, clean, basic good hygiene, separate room, mainly because whatever we give goes out in the urine, and it takes about 2 to 3 days for the biological half-life to be completely excreted. So if you were to use a restroom, if your chappals would touch it or your pallu would touch it, and it would stick somewhere, it's extremely sticky and it would radiate from there. So it's important for you to understand this and keep good hygiene in the toilet. And the amount of time you spend with others, that's important. Maybe a minute or 2 is okay. If you're just coming out of the room to serve yourself some food or something like that, that's okay. But not sleeping together or holding, being with children together or watching movies together. These kind of proximity interactions should be avoided. Distance, about 3 meters distance is what I usually tell my patients. About 3 meters is about half a sari. If you fold a sari into half, that would be like 3 meters. And the waves attenuate. The waves are thicker in the closer to the body, and then they become thinner and thinner. So hardly anything would reach that amount of distance. So maintaining distance is important. If somebody is about 3 to 4 meters away, very little would go that far. And shielding. An 8-inch brick wall is what would be needed to avoid the rays from coming from this room to the other room. Meaning, this is just to rearrange your furniture and such. If there was a thin wall or a window, the rays, if you were in this room, would possibly gaining entry to the other room. So just to use this kind of logistics to make sure nothing goes on the other side. And mainly once you go today, you need to be on low iodine diet. Most common source of iodine in our food is salt, iodized salt. There was an endemic of goiter all over the world, and epidemic of goiter all over the world, and so they mandated that the salt is iodized to prevent iodine deficiency. There are forms of salt without this fortification of iodine available. Our front desk can give you some links if you can find any. Mainly it's rock salt or salt, pink salt, things like that, which are not having additionally added iodine. There is also a list of items in our patient brochure which shows which other items have iodine. Basic things like iodex, ambritanjan, recent CT, iodinated contrast, CT scan, Japanese cuisine, seafood, things like that, seaweed especially, any kind of animal products, cheeses, all of the cough syrups, they are all known to have iodine. It's a good idea to read the label and to to stop eating these items at least for a week before, mainly because we want the iodine receptors in the thyroid empty. So the medication we give goes in, sticks better, and delivers a maximum benefit. And it's a stronger and a better effective treatment at the first dose itself. Typically, it would take about 2 months for you to see effects of this treatment. We would measure some blood tests and look at your symptoms and start a lifelong T3, T4 supplement, which is more like a multivitamin. It doesn't have any side effects, but it would be needed for you to take these Thyronorm or thyroid supplements to do the same job what the thyroid is doing now. Since we are burning it, you need to take that lifelong. That's a very important point of note. But these don't have side effects like the medications you are on right now. So that's a good thing. If you have any further questions, feel free to email us or ask us on the duty mobile number posted below. It's usually ordering it comes in your name, it comes from Bombay. There is a deposit of such made, and it comes every week. Typically we put in the orders before Saturday and it comes in the next Wednesday. The dose comes for the patient and we cannot use it for any other patient. These are some of the basic things which you need to know about iodine. The half-life is about 8 days, meaning every 8 days whatever we have given comes down. So it could essentially stay in your body for up to a month. If you are working in a space involving children or pregnant women, special word of caution, we can give you a special letter to stay away from them, work from home and such. And also the airport alarms could be triggered because of this. We can give you a special letter because of that. And I think that about covers everything you need to know. There's more information on the brochure, so we can always take any more questions you have. Thank you.